I'd like to introduce Senator Tim Ashe, who's also the President of the Senate, Senate Pro Tem. Thank you so much for joining us. And Tim's going to give us a little overview from his perspective on what's happening here and abroad. And if you have any particular questions for him, he will welcome those. Thank you so much.
All right. Yeah, I'm not going to talk about international politics this morning, although I'm happy to at another time. I'll talk about a few themes that are particularly urgent to me right now. The first of all, I don't want to be repetitive of what you're going to be hearing all day, which is that with the federal government looking more volatile than ever from a budget point of view, it does create a bit of there's a bit of a cloud over the legislative session. For instance, we came in this year, and I think if we had had a different result in the presidential election, our approach to cleaning up Lake Champlain might have looked and felt differently. We have a problem of cleaning up our lake, which is it's estimated at about $120 million of public effort a year, okay? What the newspapers will frequently say is $60 million in state money is needed, and that's because we're counting on $60 million in federal money. Well, when the Trump administration proposes a 30% reduction of the EPA, some people might think, oh, some geeks who look at spreadsheets all day are going to lose their jobs. But what that actually means is the money we've been counting on from the federal government is going to be like evaporated, to use a water metaphor. So it means that as we go about trying to address all of the challenges that we have, and we have many in the state, we do it with this air of uncertainty about how much federal support there will continue to be. And it makes it one of the more, every year is unusual here because we're a bunch of unusual people in the legislature, but it's made it harder to understand how we can marshal the resources to solve problems. It's one of the reasons I have said that we are likely going to have to come back in mid to late October after the federal budget has passed for the year to see where things have sugared out, and we might have to come back and revise our whole budget to make the kind of accommodations that are necessary. I can have a very doom and gloom attitude sometimes, and so I'm going to get the doom and gloom out of the way really quickly, which is that we have the following list of like heavy problems. We have affordability of housing problems at all income levels, not just affordable and subsidized housing, but so-called workforce housing, kind of middle class and starter homes for people who are young professionals. We have affordability problems in that regard. We have a mental health system in crisis. Whether you're someone who's in the community trying to get the mental health visitation you need to clinicians in the Northeast Kingdom, whether you're someone with acute psychiatric needs and you're languishing in an emergency room somewhere in the state, that's a system in crisis. We have people who are working for really meager compensation, working for our mental health agencies. So we have a staffing situation in crisis. We have a substance abuse system that, despite a lot of great efforts, has real problems. We have a waiting list of roughly 200 people just to get served in Chittenden County, people who have addiction and have said they're ready to come forward and get help. And every day they're on that waiting list, it looks like just a statistic on a piece of paper. That's someone whose life continues to either be just hanging on by a thread or is spiraling out of control. We have water quality problems, not just in Lake Champlain, but throughout the state, where invasive species, milfoils, all that kind of stuff, as well as blue-green algae starting to emerge, threatening kind of the long-term storied history of our waterways and recreational opportunities. We have a state workforce which has been stressed, asked to do more and more complex work at a time when the public sector is basically trashed and ridiculed in a coordinated assault both in Vermont and across this country. We have revenue sources that don't grow at the pace of our economy because the economy has changed, but our tax code has not. All right, I'll stop there because that's all the doom and gloom. But earlier in the session, we had there was what they call it Mental Health Day, and I'm not sure if they were here to help our mental health, but we had a whole group of people from all around the state, and I believe very strongly as legislators, I believe in the very simple mantra, which is deeds, not words. Because you'll walk around the building and there's not a single person you will find, maybe one, but there's 180 really great people who are in the legislature. But you're going to hear the same themes over and over. I love the work you do. I really support your mission. I really wish we could do more, but these are challenging times. That's the theme you're going to hear on every single issue that people in this room care about. And the truth is, we can't solve every problem to the fullest in 1 year. We can't do it in 2 years. These are problems decades in the making. So we have to make choices. And so when that mental health group was here, my deed was to say out loud, we are going to at least make progress on the compensation issue for people who work in our mental health system. The fact in my area of the state that someone working at the Howard Center probably makes about 60 to 75% of what the exact same position at the UVM Medical Center or in state government makes, to me, is just an unthinkable, unfair situation. And I said, we will make progress. Not we're going to try, we will make progress on that. Those are the kinds of things you want to hear today, is words that reflect deeds, something that someone can be held accountable for when the budget is all settled. The other thing is, we have a bit of a transition going. You might have heard that from Mitzi. We have new House leadership, we have new Senate leadership, we have a new governor, we have new people across all the agencies. One of the committees I really hope you will spend some time in this afternoon is Senate Appropriations, because Jane Kitchell, this is where I do my Eddie Haskell routine. Jane Kitchell I actually feel like we should send an invoice to the governor's office for her work. Jane Kitchell is probably the single most competent person in the state of Vermont when it comes to helping shape the budget. And frankly, I think the administration has to come to her half the time to solve the problems, because she really is the gold standard when it comes to addressing almost every single penny of state spending. And if you go and check her out in Senate Appropriations, you'll see what it looks like to have a legislator who people really can feel very proud about. And she's working with us to help make it a reality to increase the mental health compensation in that particular area. So, as I always say, every year I've been here has not been a year for dreamers, because we've always been under some financial duress. And yet it's at times of duress that you find out where your priorities really lie. So whether it's housing conservation issues, whether it's the arts and others, you will be able to judge us by our deeds rather than our words, I hope. So I'll stop there, and if anybody has questions, I'm certainly very happy to field them on any issue that's going on here.
Does anyone have questions for Tim? Thank you, that was great. Yes, we have one in the back. Thanks.
You said you were going to tell us about the pros. Where are the pros?
The pros, I'll tell you. Well, I'll tell you one of the pros is that if you were to follow the news of what goes on in the State House, whether it's in print or online or in the TV or on the radio, you would think that there is this epic battle going on around the budget in this building. You would think that there are problems of an unthinkable nature, almost unsolvable problems. But I'm going to tell you, I'm going to do a basic math here. I know it's, Lyndon Johnson once said that talking about economics or math in public is like peeing on your leg. It feels very hot to you, but to no one else. So I'm going to do a quick math, though. We have a $6 billion budget. When we walked into this building today, we were talking about a $60 million challenge. Okay? So the basic math here, this is really hot stuff, is that that's 1% of the whole budget, is what we're really talking about when you filter all that news, okay? 1%. That means the governor, the House, and the Senate essentially arrived with 99% agreement. And now we're talking about the marginal 1%, which unfortunately is a 1% that's real money. 60 million is real money, and it will affect each of your organizations. But the good news is that, by and large, what we are doing is preserving all of the wonderful things that policymakers over decades have built into our state budget. We often will get in fights, and you forget. You think, oh my gosh, we're talking about a slight diminishment in this, administrative line item or something. And then you realize, compared to every other state, we're like in the vanguard still, way, way beyond all these other states. So the good news is that our base level for most of the activities in state government is by far one of the most inclusive, forward-thinking, visionary sets of state policies that you'll find in America. We're not perfect, and we have areas we need to catch up. But that's the overarching good news, is that we shouldn't forget about that. I mean, this building is about arguments. not about celebration, right? And every year we're arguing about the marginal stuff means we should be celebrating really the bulk of what goes on. I don't think the governor came in here and said, I want to dismantle all the wonderful things that have supported your organizations over the years. That's like, because you don't hear it doesn't mean it's not there underpinning all of these discussions. So that's my overarching pro, if I were to have one. It gave me a chance to talk about Lyndon Johnson too, who I have this awful habit of reading about people like Lyndon Johnson or Huey Long, and afterwards I always come away thinking, a very misunderstood man.
Yeah. With the next president. Other questions that you have for Tim?
I have a question for you then. So, several years ago, one of the trends in the State House, and then it started getting baked into the budget, was results-based accountability. We have been hearing increasingly organizations saying they're spending a tremendous amount of time being persuasive with results-based accountability documentation and so on. I'm actually very intrigued about whether you feel like it's helped change the practices at your organizations, whether it's provided any value, because we're taking it as a matter of faith. It's in the budget. All the state agencies, nonprofits, contracted agencies are all having to do this now. And I have a fundamental question, which is it making anything different? How have your organizations changed as a result of this, or is it just another way of having the same light on the activities you do? And if someone can give me an example of how it's actually helped, it would be helpful to me.
Amy? And then,
Oh,
go ahead.
Yeah, we use it in our correctional transitional housing program, and in a sense, it's kind of based on how we're doing. You know, when we look at the adults that are transitioning out of our program, and we look at them 3 months down the road, 6 months down the road, kind of gives us a little focus on, are we doing something good?
Has it made your approach to handling those individuals any different?
I think it's a little early at this point, because
Okay.
we've only been into it about a year or so.
Okay, no, fair enough.
We've been using it for a couple of years now, and I think what it does is help focus internally how we're tracking the women that go through our programs in the future. And we've had a hard time, obviously, when they leave our program of knowing where they are or how our work has benefited them as an individual. And it's helping us have that picture more clear internally.
Okay, well that's good to hear. I'm suspecting there's probably other organizations like that. One of the things, and I don't want to geek out, but want to make sure RBA is not just performance measurement. Performance measurement is coming up with metrics about like where the person's at. Results-based accountability is supposed to say, we don't, all the tracking isn't the important thing. The important thing is the outcome. What has happened to the human being? Are they better off in the end? And that's the part, maybe it's too soon to know how the organizations will really shift, but that's an important thing, because I don't want organizations to be spending more time doing the analysis than they get the benefit from it. So if it's beneficial, we'll keep making you do it. If it's not, you should tell us.
Yeah, I'm Joe Carter with the Parent Child Center Network, and what it does is it sort of changes how we look at what we track. For a long period of time, we've been tracking numbers. How much? And how much doesn't really have as much of an impact as much as how well and whether clients are better off. Of course, we do have challenges around data, and we all do as nonprofits, and that's something we're working towards. But if we can sort of shift our focus to, are folks better off as a result of what we do? And if they're not, what is it we can do? And sort of get into the practice on a continuous basis of analyzing what it is that we're doing and whether we need to change our practice.
Okay, behind you.
Yeah, I'm also from Parent Child Center in Bennington, from Sunrise. My name's Amelia Silver. And
Are congratulations in order to you? Who got the 1.2 million?
Head Start and UCS, not Sunrise.
Sorry.
Believe me.
I hope they pay for lunch when you guys get together.
Burning arrow into my heart.
I hope
Thank you so much.
Look, I'm going to give you some
Thanks a lot.
tips. Tell them they're paying for lunch, they're hosting all the meetings, they have to pay the, for the copy machine.
We're very happy for them. I echo what Joe said, except for that I'd say one of the issues we're having, because we are small, is to implement RBA throughout our agency, which is about 30 employees. That's expensive to change the way we look at what we do. And also what we have found is that our government, our state contracts say that they're using RBA, but they're still really just looking at the numbers. They haven't adopted our criteria for whether someone is doing better. And so there's a little tension between how we have always been keeping track of what we do and whether our people are doing better, and the state requirements. So I think, it hasn't been worked out, but I am hopeful.
Well, and I'll amplify on that. So the question of aligning the outcome measurement, if you will, of the people being served or the activities you're doing is a really important one. I'm going to give a slight shift. Lauren Glenn, you're standing. Is that to make me nervous?
No.
All right. This is the new hip thing. You stand and you don't sit. So the reason why this is important for a number of reasons, and I'm going to give a healthcare analogy here. So the current thinking about healthcare reform in Vermont is that we are going to take providers, and by provider it could mean a hospital, it could mean a mental health agency, it could mean a single doctor out in the field somewhere. We're going to take all these providers and kind of pool them together and have them kind of work as a team, if you will, to meet the health needs of the population. The idea is that once they're all working together, they'll have similar systems, electronic systems, and they'll share and they'll know which patients need what at what time. And that it not only will make people better off, but it will also save some money. Well, the way that administrative structure starts is that the hospitals will be the first ones to run with this program. Now, what will happen in the meantime is that, let's say your agency is working with a family that is very low income, highly susceptible to a number of terrible health outcomes, chronic diseases, and so on. And let's say that your staff figure out a way to communicate with Miss Jones, single mom, poor, bad choices, and also lots of bad things are happening, and you're trying to work with them to improve things, and you hit a home run working with that client. And suddenly the person's life is turned around, less emergency room visits, and so on. Someone is actually going to get cash for improving that person's life. Now I'm going to tell you the sad news. It's not you. Your local hospital is going to get cash because you have done a better job. And that is something that we have to all be thinking about, is aligning the rewards with the responsibility for producing the value in the first place. So I'm a little far afield, but this is where I have to control myself, because healthcare expenses are eating every person in this room's lunch. It's why every one of your programs is being squeezed. It's why state government is in the mess we're in. It's not of any one individual's making. It's not the fault of our hospitals or our providers. It's a system problem. It has an insatiable appetite. I call it the blob. It eats everything in its path.
Thank you, that's a great setup.
But I'm also here with a group of CCV students who are taking a new course in the CCV curriculum called Social Justice and Public Policy, and part of the course objectives include learning how to do RBA. So CCV is making an investment in getting the learning into the population of folks who are going to be building our systems in the future.
All right, so having taught at CCV, I'm going to speak directly to the students for just 2 seconds, okay? This is your chance to not have, in Star Trek, there was something called the Borg, and they would do a mind meld. It's your chance to think for yourselves about whether this is the right tool to be making the right public choices. Because the people in this room who work at the different organizations, they have to do it whether they like it or not, or they won't get money. You are now in a position to tell them whether they should have to do it or not. So you are going to come back to these people by the end of this semester and tell them whether they're on the right track, or they should tell people like me to turn off the spigot and make different evaluation decisions. So that is your challenge, and you will not shirk it. Otherwise, we'll cut off your CCV funding.
Is there anyone looking at the big picture? Is RBA working? I know you're asking.
I said sometimes in the legislature we're constantly being inspected. You
Right.
can't say a word without it meaning something.
Yes.
And so I was in appropriations and I said I want to subject RBA to RBA.
Yes, good, because we.
I want to see if RBA is
At VCTLD,
making people's lives
we'd like
better.
to be a part of that, because we fund
Yeah.
61 organizations across the state, And the organizations with bigger staffs embrace RBA, and they do it well, and
Yeah.
they do it promptly and on time. And the smaller organizations who don't have dedicated staff struggle, and it takes more time away from their programming than we care to think about.
I would
So we
like,
have mixed-
I would like to say that there is a very thoughtful, comprehensive answer to that. Instead, what I would say is we have like 1 or 2 people in state government who are meant to be the overarching managers of this. One is in AHS, her name is Drew, she's fantastic. Yeah, so Drew is trying to implement this culture change across AHS, and Sue Zeller, whose I think title is the Chief Performance Officer. It's a new agey term, but she's been very instrumental in making this concept roll out. Much harder is getting the people who do the contracts with organizations to make it mean something each time it's done. One of the frustrations that many organizations come forward with is, gosh, we spent so much time just doing this analysis and paperwork. We only get $20,000. Can't you just give us the money? We're doing an important thing. Like, what's the point of all this?
We feel that way about many of the people we fund.
It may very well be that some organizations are both more appropriate for the analysis, but others should just be relieved because it's not, they should maybe do it internally, but they shouldn't have to do it as a contract requirement. So those are the kinds of things that you're all in a tough position because you want to satisfy your funding overlords, and if they're telling you you have to do RBA, you're going to do it, right? That's the way it is. But if there's different ways that we should be implementing it across state government, it would be really helpful to hear that, because otherwise, look, around state government, the people are overwhelmed. They're not like out there soliciting your input on whether we should be doing it differently.
Yeah.
So we need to hear it from you if there's something that could be shifted.
So much.
Now I'm really getting the hook. Thank you.
Thank you.